Good morning. My name is Abby Jamison. I am a doctoral student at Liberty University studying industrial organizational psychology. Today, I will be speaking to you about stress and burnout in healthcare providers. Workplace stress is defined as the inability to cope with perceived threat to one's mental, physical, emotional, or spiritual well-being. Workplace stress can lead to burnout. Burnout is a term most often applied to healthcare providers. It encompasses emotional exhaustion, depersonalization, and reduced personal accomplishment. It affects not only their feelings toward themselves, but also toward their patients, and has been negatively correlated with patient care. Right now, mindfulness-based stress reduction is the most often recommended treatment or therapy. It helps to increase awareness, the need for self-care, and self-compassion. It includes practices of meditation, body awareness, being present in the moment, and can include yoga. Our proposed treatment is traditional yoga. Traditional yoga has shown many benefits, both physical and psychological. It also has meditative and self-awareness components. It is easier to learn and much less expensive to implement. Our specific aims include to establish best practices in stress reduction by comparing MBSR and traditional yoga, to provide healthcare providers with the tools to reduce stress, to teach them how to do it on their own for long-term practice, and to increase professional quality of life by reducing burnout. Our research design, both programs will follow 8-week trainings, either in MBSR or in yoga. We will take measurements of stress, mindfulness, and quality of life burnout, both pre and post-intervention, and at a 6-month follow-up. Our expectations are that yoga will be more effective than MBSR in reducing the symptoms of burnout, both directly after treatment, and that it will directly impact their professional quality of life, reducing burnout, bringing back their joy in treating their patients. A second expectation is that yoga will be more effective than MBSR in reducing perceptions of stress and symptoms of burnout at a 6-month follow-up. As of yet, MBSR has not been effective at any type of follow-up past 3 months. We do expect that yoga will continue to be effective. Thank you for allowing me to present to you today.